So, Gary, from the conversations we've had, I understand that Support Staffordshire is a successful and very well established model of collaboration. I wonder if we could start today's conversation by you just talking us through the key stages that brought you to this point and what the key drivers were in seeking to work more closely together across the county.
Like a lot of local infrastructure organisations, we historically had a district council level footprint of multiple CVSs across an area. And there'd been a lot of collaboration for a decade or more between them, some successes, some not so much. And then in 2013, there was a real kind of trigger, which was that our county council decided to go out to a competitive tender process for the infrastructure support services. And that resulted in this service, the tender being awarded to a different organisation, leaving the remaining sort of district CVSs without that investment. That prompted a series of events which led to merger a couple of years later. So in 2015, there was a six-way merger of district CVSs. And then to sort of fast forward a bit, there was a seventh merger a couple of years later. And then a year after that, in 2018, we took on the Rural Community Council function as well. That was not a merger, that was with the existing original RCC winding up and closing down, but we took on that function in addition. So we became an ACRE network member as well.
It sounds like the merger, in essence, is prompted from the retendering of the infrastructure support. Has the whole merger agenda been fairly stable since then? Has it consolidated and settled down, or are there still elements that play out beyond those formal stages?
Yeah, so the process of merger was done, I guess, relatively quickly, and then other collaborations followed in the next 2 or 3 years. In the midst of that, there was also the resetting of the relationship with the county council. So the fact that we'd come together and merged and were able to have that county-wide coverage of the whole upper tier authority meant that we were in a much stronger position, and then effectively re-secured that investment from the county council. And then I guess there was probably sort of another 3 years or so where it was quite steady and quite gradual, and there was a lot in the background of the organisation of policies and systems and consolidation, and because we'd inherited, in some cases 6 lots of things, and that process wasn't quick, and we had to sort of bring the staff teams together around that. And then we went into the kind of COVID and beyond phase, and what we've seen since then is a real growth since then. So the relationship was really solidified through COVID. And if I say, like, at the point of merger, we were about a 30-40 staff team and about 1.2 million turnover. Here we are now, sort of, where are we, 6 years on from COVID? We're at about 4 million turnover and about 120 staff. So we've had quite a steady but sustained year-on-year growth for the last 5 or 6 years, really.
Appreciating that this is a big question, I wonder if you can share any key lessons with others that may be either embarking on this journey or perhaps a some way along the continuum of closer collaborative working.
I think what I've probably learned is to try and keep uncertainty short if you can, and bring staff together as much as you can afterwards, then to kind of rebuild. With uncertainty, you're always going to get a chipping away of, to a degree, of trust and relationships. So trying to keep that uncertain period short and then bring people together afterwards to kind of reform. We really tried to focus upon, like, refreshing our kind of values and, like, the core of what held us together as a group of people collaborating. Even if we were working from slightly different systems and processes and things were going to be a bit messy for a while, we had that clarity of kind of what we all cherished. And I think for a lot of us, it was around that kind of localism and supporting our local sector. And that was the thing we had in common, even though we were working in different geographies. Some practical things: we've always said reserves are for a rainy day. And in the first 3 or 4 years, we spent reserves because it was raining. I guess what we then moved on to were we started to establish Support Staffordshire ways of doing things. So we did that collaboratively with the staff teams to use their expertise and tried to take on the best of the different partners. But then we had, right, this is now the new way that we do things. Again, that took a while, and we had to work that around the organisation. And in doing that, some people decided to get off the bus. Some people decided it wasn't for them anymore. And we tried to make that relatively easy for people to do. Just accept the fact that some people, the difference would be too much, and to let them leave with respect and dignity and their head held high and in the least disruptive way. And then the last thing I'd probably say would be around some of the key personnel. In that merger process, I initially inherited, I think, 4 chief officers. 2 decided to go and 2 decided to stay. We managed to get that right. And then those 2 people have been here as real, like, steady rocks of the organisation for 10 years. But they have provided a level of stability because they were the right people. And then trustees as well. So we had a really strong, assertive chair that drove through the merger and kept things moving through the merger process. They were absolutely the right person for that. They were absolutely the wrong person to then embed the new kind of build the new relationships, because they'd almost been perceived as that person that drove it through. So then the vice chair actually stepped up and became the chair, and she's actually still our chair because she's been so good at that relationship building. So, getting that kind of core team around me, particularly as the chief exec, I couldn't have done it without those sort of 3 or 4 people, and particularly the trustees playing slightly different roles at different times. We were sort of inheriting a whole load of trustees from all of the different organisations. They wouldn't all be becoming trustees of the new organisation. And I think this is the thing we didn't get right. We didn't manage the message well enough with those who were perhaps walking away at that point. And we ended up then having to retrospectively manage this rumour of our demise, which wasn't true, because they were going around saying, "Oh, we're closing." Well, the individual ones were closing, but the new entity was taking that on. But if you can try and manage that message and tell us positive, a stronger story through those trustees, because people will listen to them, I would say that was something that we got wrong, and I would do differently. There's one particular story that springs to mind, which was about a year into the merger, when one of the district councils pulled all their voluntary sector grant funding. And it was quite stark, really, because what it showed to us at the time was if there'd still been a district local infrastructure organisation at that point, it would have gone under at that point. Whereas because we were across a bigger geography, we were able to effectively sort of live to fight another day. So we drew back our actual delivery in that particular patch considerably, but then we were able to rebuild it back up again over a number of years, and it's quite established again there now. So there's something about that sort of the tactics of and the sustainability, I guess, or resilience probably, of covering a larger patch. I think also we were really clear in the early days that we had to get the basics right. We had to have those core functions of infrastructure and do them well and clearly, and try and get a level of coverage across the whole geography before we could then step on and start to grow and develop and do other things. We've taken on things like Health Watch. We've taken on a role working with the Local Resilience Forum, which happened a couple of years after COVID. And a huge portion of our growth has been working with the NHS. Now, again, that would have been pretty impossible to do if we hadn't have been on the bigger footprint that was, closer to their operating footprint. And we've taken on social prescribing through that and other work with the ICB and other providers. There's the piece of research that was done at Sheffield Hallam, Professor Rob McMillan, that talks about spirals. So either downward spirals or upward spirals in infrastructure. We are absolutely bang on that example of that upward spiral, that in a way, once we'd got the foundations right and we started to be recognised and deliver good work, opportunities started to open up and come to us. You know, I'm not saying that me and the team haven't worked hard, because we have, but those opportunities have presented themselves, and we've been in a strong position to then grab them and take them.
So we know that change is coming. We don't quite know what that change looks like yet in Staffordshire, but do you feel well prepared in the sense that you've been through similar kind of processes before?
I mean, you can always be better prepared, I think. And it's really tricky working through when you don't know ultimately what the end game is. So there's 5 different options on the table for Staffordshire and Stoke-on-Trent. The advantage that we're in is that there's fewer of us to start with. So when we're trying to have those collaborative conversations, there's really 2 main local infrastructure organisations on the patch, and we work really well with each other, and we're not in a position of competing with each other. So our start point is pretty solid and strong, I would say. I think it also means that we're in a strong position in terms of the kinds of arguments that they're making for LGR around working across a bigger geography and doing things once across the area, because we already do that with a lot of our work and our services. So we're almost like one of the partners that already work on the larger footprints that they're talking about. Ironically, I think that means that we're in a stronger position to then advocate for what we want to see through LGR, which is actually the local. But we can do that from a position of strength rather than trying to defend our own local position, maybe.
What dialogue have you been able to engage with at this point? Are you able to read what might happen and potential permutations? Are you able to get in the rooms that you need to with those who may be driving those kind of key decisions? Is it possible to control some of what's actually a very uncertain process?
I mean, we were able to reach out quite early on, and I met with the county council leader, and also I've met with the chief exec. We've had some political change here as well since the original plans came out. So we've gone from a Conservative-led administration to a Reform-led one. It's disrupted, I suppose, because we've had to build new relationships with politicians in particular, and also the actual capacity of the council to engage was limited during that changeover period. But again, because it was us coming as the infrastructure organisation in the county, they were quite willing and able to meet with us, and I have met with them on a number of other occasions. It's not multiple people asking to meet from a VCS perspective. What we've tried to do is to say we'll work with whatever option comes out of it. In terms of it's not for us to say what the organisational form should be, and we will exist and continue to work with whatever structure comes out the other end. But here are some parameters that we think are really key and really important. And then also, and here are some things that we can offer you to help through the process. So we set that out in the meeting, and we followed it up with a letter in writing. And it, probably no great surprise what would be in there. It was things around remaining local, remaining in touch with communities and people, the council not feeling more distant. That is now beginning to lead into more specifics around what their neighbourhood governance arrangements are going to be. Are they going to be area committees? Are they going to be participatory budgeting? So I think by kind of setting our stall out at the beginning, we have positioned ourselves so that we are involved in that conversation and quite in the heart of the conversation. I think we talked more from an ACRE network perspective about that being particularly important for rural communities that were potentially going to find themselves much further away from the physical centres of administration, which were likely to be in the urban areas. So we've really pressed on that from a kind of rural communities point of view as well.
Could you tell us a little bit about how the membership have responded to this period that we're going through now, waiting for the outcome around your particular model of local government reorganisation? What kind of things are they saying to Support Staffordshire? What are they looking for, and how are you able to respond to that, given the uncertainty that we're seeing right now?
If I'm honest, I think a large majority of the membership are unaware, or even if they're peripherally aware, they're not really clear about how it might affect them. So quite a big piece of what we've been doing is just repeating make yourself aware, and here's where you need to go, and this is where we're at in the stage of the process. If they are slightly more engaged and involved, it is likely to be because they have some kind of direct relationship, perhaps with the district council, they're in receipt of some grant funding, or they might be delivering on a service of some kind for one of the local authorities. And that probably then relates to almost like our second key point that we put forward when we wrote to the county council in particular, was that we were really keen to ensure that any consolidation was not used to shrink the overall voluntary sector investment. So we've kind of said a red line for us is no net reduction in VCSE investment. Now, what we're trying to do as we begin to get nearer to sort of implementation and work streams is to land that with one of the work streams, because it's probably not going to get a work stream on its own. And then there's a piece of work to do, which is, okay, what's the baseline for that? What are we going to include in what's already been invested that needs to be protected as we go through the reorganisation process? Like the officer level that we work at, it's been quite, that's been well received, and we've generally speaking in Staffordshire, probably with the exception of one district council, we've tended to see investments protected in the voluntary sector at the expense of in-house. So most community development teams have gone, for example, from district councils, but they've protected some level of grant investment into the sector, which is not necessarily true across the country. So in terms of zooming out in the bigger picture, there's like three factors that I currently have I literally have it on a spreadsheet, which is labelled a change barometer, and I report to the board on it. And it's devolution, NHS system change, and LGR. Now they're happening probably in the order of NHS first, LGR second, devolution third. There's probably an argument that ideally they would happen in exactly the opposite order. So on our patch, what we're talking about is the Staffordshire and Stoke-on-Trent ICB, the health system, clustering with the Shropshire and Telford and Wrekin ICB system, and that'll become one ICB. There's no current LGR in Shropshire and Telford because they're already two unitary authorities. There is LGR in Staffordshire with a number of different options on the table. The devolution conversation has not got very far, but the best guess is that the strategic authority and the potential mayoral system would cover the same footprint as the ICB. So that's the sort of basis on which we're thinking at the moment. And I guess the other little bit of that is what's known in the NHS structures as the place arrangements. There's probably a working assumption that at some point their place arrangements will mirror what's expected to be 4 or potentially 5 unitary authorities, so the existing 2 in Shropshire and Telford, and then 2 or 3 new ones in Staffordshire. What we don't know is what functions will sort of be devolved to place, what functions will go up to the whole cluster across all of Shropshire and Staffordshire, and what, if anything, would stay as like where they are now as just Staffordshire and Stoke, or just Shropshire and Telford, because there won't be an NHS entity at that two current system level, and there won't be local authorities won't be at that function either. So the sort of the footprint on which we now work is the bit that will actually completely disappear, and things will either go kind of up to a bigger geography and more strategic, or they'll go down to a place arrangement, but we're not sure what goes where yet. So that's the sort of big uncertainty.
From the outside, it looks like there could be some opportunities for alignment between the kind of approaches we see to working locally in the NHS 10-year plan, moving more care out of hospitals and into communities, one of those 3 big shifts, and what local government reorganisation is trying to do through more neighbourhood working and devolving services down to a kind of more local level. Do you think ICB and local authority colleagues are starting to think in those kind of terms? And is there anything that the voluntary sector can do to maybe help align what might look like quite similar approaches from the outside?
Yeah, I think there's definitely huge opportunity, and I think they are seeing the potential, and they are beginning to think about it. I think they're both constrained. Both systems are a bit constrained by sort of what gets layered down from them from central government. So I would probably almost describe there's 3 bits to it. So one is the existing sort of town and parish council system. It's the most local bit, and a lot of counties are going through the same experience as us, which is to have fully parished areas, which in particular tends to mean the towns, the big towns that are not parish but are served by borough and district councils. Then you've got the relatively well-structured or established sort of NHS approach, which is broadly around sort of primary care, PCNs, although there's some sort of flex to that, and how do community teams in trusts work alongside that, and where do the PCNs not necessarily mirror the real geography on the ground, and how can they work to align probably much bigger footprints of PCNs, which are, you know, likely to be kind of 30 to 50,000 population, whereas town and parishes are often going to be working at, you know, anything down to a few thousand people, a genuine neighbourhood for a parish council. A big town council might be working at more like the PCN footprint of sort of 50,000 maybe. But there's a lot of room in that space in the middle. What I hope doesn't happen is we just end up with three parallel structures, each slightly kind of jostling for position with each other, rather than trying to collaborate and make the best use of one another's sort of assets, really. Most of our growth has come from health. 7 years ago, it was pretty much zero income. It's now over 40% of our income. It's the thing that our trustees often ask me about, you know, around the resilience of that income, because it's ultimately all NHS money. It's multiple contracts. It finds its way to us. You know, I'd probably say there's broadly three components to it. There's the alliance, so what we call Healthy Communities Alliance, other areas called VCS alliances. So we've been able to lead on that and provide quite strong leadership on that. There's broadly social prescribing in lots of different contexts, primary care, secondary care, and a bit more working in hospitals as well now, which is quite almost service focused, but we're that independent broker. And then there's a whole piece around health inequalities that we're doing that's much more kind of asset-based community development, trying to keep all three strands and make an argument as to why you have to keep investing in all three of them and why they're different from each other, and slightly different audiences for each of them. You know, one's quite service focused, so we're working much more with provider trusts, some with GPs, and really the ICB is not involved in that conversation. Obviously, the alliance, that's very much ICB trying to make the case for them to continue investing in infrastructure in the background and to extend that across that whole cluster. And then the health inequalities work is much more complicated, because that's a bit of everyone. You know, that's public health in the local authority, as well as the ICB, as well as the provider trust and primary care. So that's almost like the trickiest, probably in some ways, to navigate, because it's got so many different partners.